My name is Damon L. Jacobs. I'm a licensed marriage and family therapist in New York State. A lot of the science that's coming out just really builds and validates on what we know and what has been proven and what has been validated. And gratefully now what the US CDC has acknowledged on their page, that PrEP is 99% effective when taken as directed by people of all genders, of all races, of all sexual orientations. And so to be able to hear people continue to validate the research and the science that we have and really think about what that means in terms of trusting this as an intervention is very powerful, as well as the science and data that supports U equals U, otherwise known as treatment as prevention. This term agency is so important in ending the HIV epidemic, whether we're talking about PrEP or whether we're talking about a person living with HIV using tasks for U equals U. And basic to that notion is the idea that all people deserve access to accurate information and facts so that they can learn what sexual health decisions are right for them, and then have a conversation, ideally with a provider or prescriber, about what choices they're making. I started a group on Facebook on July 1st, 2013, and the intention behind that was to create a community around prioritizing facts over fears, science over stigma, data over dogma, and giving consumers an opportunity to learn their choices and to have discussions and yes, sometimes debates about these new biomedical interventions that can really enhance the quality and quantity of our lives, as well as enhance the experience of sexual pleasure and connection. And I really bring home that last point because for most of my career, that has been left out of the conversation about how significant and meaningful sexuality is and how sacred spiritually and sexually semen exchange matters for so many people. Hey, we all got here because of somebody exchanged semen with somebody. So when we leave that out of the conversation, we're leaving out a lot. And so this opportunity to include that as part of agency, as part of choice, as part of being proactive, responsible, and empowered about our pleasure and protection, it opens up this new vista of enthusiasm and excitement that I've never seen in the HIV prevention community before PrEP. And then it also really helps the consumer stay adherent, because adherence is very important for PrEP to work, whatever regime or whatever strategy they're going to use. It's really important that they use one that they can stick to. And when consumers are making that choice from a place of agency and empowerment, they're so much more likely to stick with the regimen that they've used in order to prevent HIV.